Hi there. I'm Samita Coco. Yeah, I'm here to do my OSCE examination. Okay, yeah, I have all my notes. 30 minutes, okay. Alright, let's get started. Hi there.
Hi.
I'm Samita.
My name's Julia.
Nice to meet you.
Nice to meet you.
Thanks for allowing me to do this exam on you.
Of course.
So, Julia, I've heard that you have headaches. Can you tell me more about that?
Sure. So it started this morning, and it just is an achy, dull headache that covers my whole head.
Okay. So you say it started this morning. Around what time would you say?
I'd say about 8 in the morning.
Okay, 8 a.m. So
Yeah.
about like 4 hours-ish right now?
Yeah.
Okay. And how intense is it?
Right now, I'd say it's an 8 out of 10.
8 out of 10. And in the morning?
It's like a 5 out of 10.
Okay.
Keeps
That's
getting
good to
worse.
know. And have you ever had this headache before?
No, this is my first time having a headache like this. Yeah.
Okay. And do you find that, is there anything that helps this headache at all?
I tried taking Tylenol earlier, but it doesn't seem to be helping.
And anything making it worse?
Well, it was really bad in class, and that seemed to aggravate it. Just being in class, focusing, concentrating.
Yeah. And that's why you came here?
That's why I came here.
Okay, perfect.
Yeah.
And do you have any other symptoms besides this headache right now?
I seem to have lost my appetite, and my neck feels really stiff. And my hands feel cold, but my body feels really hot.
Interesting.
Yeah.
That's cool. Well, I'm sorry to hear that, but I do have a few more questions if you don't mind.
That's fine.
Have you had any injury or trauma to your head at all?
No, not that I can remember.
No trauma? Okay. You haven't like hit your head, fallen, anything like that?
No.
No? Okay. Have you been experiencing any nausea or vomiting?
No nausea or vomiting, just the loss of appetite.
Just loss of appetite? Okay. Have you had any changes to your vision?
Well, I seem to be really sensitive to light.
Okay.
Otherwise, it's all normal.
Okay, sensitivity to light. Have you had any like flickering lights, any like stars, or any like double vision, anything like that?
No.
No. Okay. Do you have any numbness or tingling in your body?
No.
No. Have you had any loss of consciousness since the headache started, or even before that?
No.
Okay. Have you had any skin rashes at all?
No.
None that
Skin
you've
rashes.
noticed? Okay. And do you feel dizzy?
I feel a little fuzzy or I feel like I am experiencing confusion, but maybe not dizziness specifically.
No dizziness. Have you been sick at all lately?
You know, about a week ago I had a sinus infection.
Okay, sinus infection a week ago. Did you get it treated?
No.
No, okay. So it's still kind of lingering a little bit?
Yeah, a little bit.
Okay, we'll definitely check that. And do you find that your headache gets worse with like normal physical activity, like walking or climbing stairs or anything like that?
That doesn't seem to affect it.
Okay. Just a few more questions.
Okay.
You said that you haven't experienced any headaches like this, but have you experienced any other headaches in the past?
Maybe occasional tension headaches, but nothing this painful.
Okay, yeah, that's painful. Are you taking any medication right now?
No, I'm not on any medications. I tried that Tylenol.
Just the
Other
Tylenol?
than that, I'm taking a multivitamin every day.
Multivitamin as well?
Probiotic.
Your probiotic.
That's it.
Okay. That's good to know. Are you drinking any coffee?
I do have a cup of coffee per day.
A cup of coffee. Did you drink coffee this morning?
Yes.
Okay. Did that change your symptoms at all? Aggravate? Didn't seem to? Okay. Do you have a family history of headaches? Anyone in your family?
You know, I think my mom gets migraines on occasion.
Okay.
Yeah.
Okay. Well, that's all the questions I have for you.
Okay.
So I'm going to go ahead and start with your vitals, if that's okay?
Yeah, sounds great.
I'm just going to go ahead and sanitize my hands.
Sure.
Okay. Are you okay sitting up like that?
Yeah, this is fine.
That's fine. Just let me know if you feel any discomfort.
Okay.
Just gonna have you put that in your mouth, under your tongue, and just hold that for a minute. I'm just gonna take your pulse. Okay, relax. Is that okay with the blood pressure here?
Mm-hmm.
Okay, just relax your hand. It's still going. If you don't mind raising up your hand and then pumping it 10 times. Okay, I'm just gonna have you relax just like that. Thank you.
Mm-hmm.
So your blood pressure's a little low, around 90/75. Okay, so it does look like you have a fever,
Okay.
38 degrees. Are you feeling hot? You said you were feeling a bit hot?
Yeah.
Yeah? Okay. So now that I'm done my vitals, your vitals, I'm gonna ask you a few questions.
Okay.
So, what day is it today? You know?
Wednesday.
Is it Wednesday? Okay. It's actually Thursday, but that's all right. Can you start from 100 and subtract 7?
92. 93.
93, okay. Keep subtracting.
7
93,
more.
7 more, yeah.
80, 85.
85?
78.
Okay. Okay, you can stop now.
Okay.
Okay. So I'm just gonna take a look, just a general inspection. You do look like you're flushing a little bit. So to check your temperature. Okay. Alright, but I don't see any cyanosis or any pallor, which is good, just a little bit of flushing. Okay. So I'm just going to palpate your skull, right? And I want you to tell me if you feel any pain or tenderness. Sorry. I'm a little nervous. Oh, okay. You know what? I'm just not going to use these gloves. Okay.
That's okay.
So I'm just going to go ahead and palpate your skull.
Okay.
So just let me know if you feel any pain there.
No.
Okay. You don't seem to have any enlarged temporal arteries, so that's good.
Okay.
So no scalp tenderness overall. Okay, I'm going to percuss your skull.
Okay.
Any pain?
No. Maybe some discomfort as you go towards the back.
Okay. It's good to know. Okay. Alright, now I'm going to have you do neck movements.
Okay.
So I want you to flex forward like this. Can you do that? No.
I don't think I can do that.
Can you go this way just slightly? Okay.
It's too painful.
The other way? Is it all too painful?
Yeah.
What about rotation?
That one's a little better.
This way? Okay.
It's all pretty painful.
It's all pretty painful?
Yeah.
I'm just going to palpate your neck as well.
Okay.
How does that feel?
It's pretty stiff and sore.
Okay. What about in the front here?
Not as bad in the front.
Okay. So I'm just going to inspect your eyes. So you just keep your eyes open, just kind of like look forward there. Just looking for any... Oh, sorry. Okay, no
I'm
worries.
so sensitive to light.
Yeah, I'm just going to go like this then. Okay, so it doesn't look like you have any ptosis. I don't see any injection of the eyes either. And there's no like lacrimation, no tearing. So that's good. No eyelid edema. Okay, and no lateral thinning of the eyebrows either. I do want to check your eye movements, so don't move your head. Just follow the tip of my pen here. Okay. Okay, that's good. Okay, good so far. I see that you're following the pen pretty well. Okay. Okay, very good. And then I am going to check for your pupillary constriction. I know it's going to feel uncomfortable.
Okay.
Just keep looking for it. Just want to see if there's any meiosis at all. Sorry about that. Okay, good. I know. Okay, so your pupillary constriction looks good. There's no meiosis or too much dilation either. Okay. I'm going to look into your eye.
With another light.
Yes. I'm sorry.
It's okay.
I'm just going to use this an optic. I'm going to try to keep it at a lower light so it doesn't bother you as much.
Okay, thank you.
Hopefully that's better. I do have to turn off this light though.
Okay.
Just gonna... Okay. So that's not as bad, yeah? So just look straight ahead again at that clock.
Okay.
And it's gonna come in. Actually, that's a little too... Sorry. So your optic disc looks good. Okay, look over this side. Just looking at the optic disc. Just gonna cover. Okay, perfect. Yeah. So the outline of your optic disc is perfect. There's no blurred outline. There's no swelling. I can see the venous pulsations. So there's no papilledema. I can see. So that's very good. Great. I'm just gonna turn this back on.
Okay.
How are you feeling?
I feel good.
You feel good? Okay. Okay. So I am going to do a few muscle tests on you.
Okay.
So I'm just going to have you resist against me. So we're going to do this first. So resist against me. Okay. And then we're going to do this. Resist against my hand. Okay. And then resist this way. Perfect. Okay. So I'm going to do here as well. And if you can resist against my hand. Good. Down here. Good. And then here. Like upwards. Yeah. Yeah. There you go. And then down. Good. And your toes. There you go. This way. Good. Perfect. Okay, so your motor function seems to be intact.
Okay.
I would say I would rate it all a 5 because you're able to do it against resistance.
Okay.
Next, I'm going to do your deep tongue reflexes.
Okay.
So I'm just going to do this one. If you can just relax as much as you can. Okay. This one here. Just relax as much as you can. Okay. And then I'm going to do the biceps. Good. Good. And your brachioradialis. Just keep it like this. Just relax. Good. Good. Okay. Just gonna make sure you can find that. Okay, not too bad. Try that again. Oh. Okay. Perfect. There we go. Okay, so that's more brisk, and I would say that's more normal. Okay. So I'm gonna go ahead and check your vibration sense. So please close your eyes and let me know what you feel, and then I'll just kind of guide you as we do this.
Okay.
What do you feel?
Vibration.
Vibration.
And it stopped.
And it stopped. Okay, good. Try the other side.
Vibration.
Vibration.
Stopped.
What do you feel?
Nothing.
Nothing. Good. What do you feel?
Vibration. And stopped.
Keep your eyes closed.
Sorry.
What do you feel?
Nothing.
Nothing.
Vibration. Vibration. Vibration.
Other side.
Vibration. Stopped. Vibration. Stopped. Vibration. Stopped. Vibration.
Okay, keep your eyes closed and tell me what you sense. What do you feel?
No vibration. 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 And it stopped. Vibration. Stopped. Vibration. Stopped. Vibration. Stopped. Vibration. Vibration.
Good. So your vibration sense is intact for both your upper extremities and your lower extremities.
Great.
We are going to check your proprioception.
Okay.
So what I'm going to have you do is alternate your hands like this and do it as fast as you can.
Okay. With my eyes closed or open?
With your eyes open is fine. Okay. Okay, perfect. And now I'm going to have you touch your nose and then touch my finger, okay?
Okay.
Okay, let's do it. We'll go back to your nose and back to my finger, back to your nose, back to my finger, back to my finger. Okay, good. Good. Okay. Actually, that was coordination. Sorry, that was coordination.
That's okay.
Proprioception, we're going to actually try to put these on again. So I'm going to have you close your eye. Actually, keep your eyes open for now. And
Okay.
then this is up,
Okay.
this is down.
Okay.
Okay? Up, down.
Okay.
Now close your eyes and let me know.
Down. Up. Down. Down.
Okay?
Up. Down. Up. Down.
Okay, good. Perfect. Okay.
Okay.
So I'm just gonna have you, yep, just like that. And then you're gonna keep your eyes closed and let me know. Actually, I'll show you. So
Okay.
this is 2,
Mm-hmm.
and this is 1,
Okay.
right? So I'm gonna keep asking you, like, do you feel 2, 1, or like what do you feel? And
Okay.
you say
2 or
whether
1.
it's 2 or 1, exactly. Okay, so keep your eyes closed.
1. 2. 2. 2. 1. 1. 1. 1. 2. 1. 2. 2. 2. 1. 2.
Okay, other side.
2. 1. 1. 2. 2. 1. 1. 2. 1. 2. 1. 2. 1. 2.
Okay, great. So you're able to 2-point discriminate quite well. Okay. So the next tests, I'm going to actually check your head and neck. So first I'm going to check your lymph nodes.
Okay.
So I'm just going to let me know if you feel any tenderness at all. That one might be a little,
They are tender.
but they are mobile, so that's good. Just gonna have you. I'm just gonna go in deeper. Is that uncomfortable at all?
Neck flexion's a little uncomfortable. But
Sorry.
it's okay.
Slightly. Okay. There's a few lymph nodes that I could feel, but they were completely mobile.
Okay.
And there was no enlargement of any of the lymph nodes, so that's good.
Okay.
I'm actually gonna have you shrug as well. I'm just gonna check there 2, and then depress your shoulders. Good. Okay, great. I'm going to check your sinuses.
Okay.
So just let me know if you feel any pain. Is there any pain?
It's okay.
It's okay. Let's try these ones.
Good.
You're good? Okay.
Yeah.
And I'm just going to also transilluminate. So basically just putting a light against you and then seeing if there's like a red reflection.
Okay.
Sure, I'll try not to get it into your eyes. Perfect. Good. Open up your mouth, please. Good. Good. Okay, so your sinuses look clear.
Okay.
That's good. Just checking. There's a little bit of redness in there.
Mm-hmm.
There's no nasal discharge and no obstruction.
Okay.
And then I'm also going to check your oral mucosa.
Okay.
So if you can just say ah. Okay. Good. And then just put your tongue up small. Good. Alright. So I didn't notice any redness of your throat or any discharge, any phlegm back there.
Okay.
And your tonsils were not enlarged either, so that's good. And no ulcers or anything. And your teeth look fine as well, no cavities that I noticed.
Good.
Okay. Okay, so the next few exams, I'm actually going to have you lie down with your head over here, where I can help you. Okay. So what I'm going to do is a Brzezinski test.
Okay.
So I'm just going to slowly.
That
Okay,
hurts.
okay, that hurts. Okay.
Yeah.
Okay, go back down. Okay. And I'm just going to come here. So I'm just going to lift your leg up slowly, and then you let me know if you feel any pain at all.
Okay.
I'm just going to slowly extend.
That hurts.
That hurts?
Yeah.
Okay. Let's bring that back down.
Okay.
Okay. Okay, good. Okay. And Julia, we're just going to do the Babinski's reflex.
Okay.
So I'm just going to hold it like this. And just looking at. Okay. Okay, so your toes did curl in a little bit, which is good. If it were to fan out, then that would be an upper motor neuron issue, which we don't have, so that's good. I am actually going to I realized that I forgot one of the DTRs, so I just have one more DTR, deep tendon reflex that I have to test on you. Just gonna hold this up like that. Good. Good. Okay, Julia, so we have, so it looks like we have completed your exam. Do you have any questions for me?
What do you think's going on?
So according to the tests that I've done, and as well as your history, because you do have a stiff neck and you've got a headache as well as some confusion when it came to subtracting the numbers as well, and as well as what day it was, and also the high fever. I would suspect bacterial meningitis, and also the Koenig sign and the Brzezinski sign were both positive, which also suggests that. However, we're not completely sure. I can't give you a definitive diagnosis. What we're going to do is send you to the emergency just across the street and probably do a lumbar puncture, maybe do a CBC, which is a blood draw test, and go from there. We might have to put you on antibiotics, but I'm not too sure right now. So we'll send you over to the emergency.
Okay.
Thanks so much.
Excellent job.
Okay.
Thank you.
Bye. Thank you so much for your help. I guess I'm done. I think I did okay. I guess you can't really tell me anything. Anyways, it was really nice meeting you, and thank you so much for examining me today. Yeah, I better get going. I know the next student's coming in, so anyways, thank you. Thanks so much.